It is sponsored by the University of Utah Health. Well, as many of you know, I am growing because I am pregnant, and today Dr. Jennifer Kaiser is here from the University of Utah to shine a light on women's health and early pregnancy care. Welcome to the show. I'm excited to have you.
Thank you so much. Excited to be here.
Well, thank you. Okay, so what should people expect in those early weeks of pregnancy? There are so many questions and concerns for women who are newly pregnant.
Yeah, so the first trimester early on in pregnancy can be a really confusing time. It can also be really exciting. There's lots of different symptoms that are very common and also can be pretty normal. Things like nausea, fatigue, breast tenderness, some cramping, spotting, all of those can be pretty common.
Yes, and I have learned, well, I'm experiencing all of those. And the second pregnancy, I have been way more sick, way more nausea, way more, throwing up. And I think a lot of it, when should people be concerned, though?
Yeah. So, there are some things early in pregnancy where we do get a little bit more concerned. So moderate to heavy bleeding, really severe pain that doesn't go away or it lasts for a long time or just makes it so you can't really do anything because it hurts so much. Vomiting a lot where, you're worried about how much you're taking in or dehydration. Those are all things where you should probably come in and see somebody.
Yeah, absolutely. I mean, that is one of the things. When you're throwing up, you want to make sure you're getting, nutrition and all of those things. And then not having any symptoms, because my first one, I didn't have any. That can also be normal as well.
Yes, some people are lucky and they don't really experience much or they have some pretty mild symptoms, and that's okay too.
It's wild what babies will do to
Yes,
you. They take what they need, don't they?
Yes.
Well, why is there often so much uncertainty in the beginning, the wait and see period?
Yeah, so very early in pregnancy, there is a lot of uncertainty, especially if you're having a complication. So in our early pregnancy assessment clinic at the university, we see a lot of people who are experiencing either some spotting or bleeding, pain, that come in because they're not sure what's going on. What happens though is that oftentimes they're too early for us to see anything clearly on an ultrasound, which only adds to the confusion and to the concern and worry. And so what we try to do in our clinic is make sure that we're answering those questions and that people are understanding what's happening and why. And so oftentimes that means doing some different lab work so that we can monitor the pregnancy hormone level and also doing some additional ultrasounds over time to kind of see if things are developing normally.
Sure, and I remember in the beginning stages of my pregnancy, you just are kind of watching your HCG levels go up and you may not be feeling all those feelings, but you're able to see it when you can't see the baby on the screen.
Right, exactly.
Well, that sounds like such amazing support and care, so talk to me a little bit about that.
Yeah, so the early pregnancy assessment clinic is something we've started about 3 years ago now at the university to help people avoid the emergency room when they don't need it. And so a lot of times people in early pregnancy who are concerned about their spotting or their cramping or other symptoms, they would go to the emergency room and wait for hours before being seen. So we know that we need a place where people can come and be seen sooner by experts in early pregnancy, and that's what we offer. So we're seeing people same day or next day when they call in, and for a whole variety of different reasons, including miscarriage care.
Well, thank you so much for all that you're doing for women, Dr. Kaiser. It's great to see you guys can find them online.